My name is Dr. Amit Kochar. I am a board-certified otolaryngologist, a head and neck surgeon, as well as facial plastic and reconstructive surgeon. And I'm the director of the Facial Nerve Disorders Program at the Pacific Neuroscience Institute, based in Santa Monica, California. This is one of our quarterly webinar series devoted to facial nerve disorders. And today I'll be taking you through some frequently asked questions that we commonly get during an initial clinic visit and during informational sessions. And so we'll be focusing on some of the basic information that patients ask during that initial visit when they're first dealing with the facial paralysis, and some other questions that we discuss along the way during those clinic visits. We will not be focusing as much on surgery for today's webinar, so I do apologize if that's what you came to find out about. We will touch upon it later on at the end, and if we have any specific questions, I'll be happy to answer those. But really what I want to go through is the background of facial nerve disorders and what patients can expect and what are the most common questions that we get asked about. And so these are the 20 of questions that we'll be going through today. And what we'll be doing is I'll be going through them, not all at once like this, but I'll be breaking them up. But this is just to give you an idea of what we're looking at. And so the most common questions we get really are just about what is the facial nerve and what is its function. And so the facial nerve is a cranial nerve, meaning it comes from the brainstem and it travels behind the ear, and then it travels under the ear, and then it travels in bone behind the ear, and then it opens up into the face. And it has 5 main branches that are responsible for movement of the face. Raising your brow, closing your eyes, wrinkling your nose or snarling, smiling, puckering your lips, and then frowning. In addition to the function of facial movement, it also has some other sensory effects, which we'll talk about in just a moment. Now, when a patient has facial nerve damage or facial nerve paralysis, what they experience is weakness of these movements. And so they're unable to raise their brow, close their eye, wrinkle their nose. If it happens acutely or suddenly, it'll cause a complete droop of the face. And so you won't be able to blink or close your eye properly. You won't be able to smile or really eat that easily. Facial paralysis not only affects the ability to convey emotion, but it can also affect other functions such as eating and speaking. And so what patients will often notice is if they wake up in the morning and the paralysis occurred overnight, the first indication that something's not working is either usually that their eye feels very irritated or dry, or when they're going to brush their teeth or drink some water in the morning, that the water comes out of one side of their mouth. And then they look at their face, or they see, or someone else tells them that their face is paralyzed. And so oftentimes patients aren't even aware that the paralysis sets in, especially when it's acute, like in a Bell's palsy. Now, we talked about the eye. The eye is very, very important when patients have facial paralysis. We often get questions about how patients can protect it. One thing we tell patients that they have to be aware of when they have an acute paralysis, whether it's a Bell's palsy or from a trauma or anything, is that the eye is the most important organ in the body that has to be protected. And in some cases, we'll just have them take a piece of tape and tape their eye shut on that affected side and keep it that way for a good, 1, 2, 3 days, sometimes 3 weeks, depending on how long it takes. In other cases, and in those same cases, we'll have them lubricate the eye, because if you can't blink, you can't lubricate and you can't moisten the eye. And that's what causes that dryness and some grittiness. And if you're not putting drops in every few hours, the eye will get very dry and will be susceptible to injury. And so we want to keep it moist. During the day, it's okay to leave it open and not tape it, but we do recommend getting some type of protective eye patch. I'm located in California. It's very dry, it can be very windy. And so patients will inadvertently scratch their eye if it's not closed or they can't blink, or dust can get in and scratch the eye. So a very easy remedy is to take a piece of saran wrap and just tape it to the forehead and to the cheek and just use that to cover the eye as a makeshift moisture chamber. Another option is to buy one. So on Amazon or CVS or other stores, you can actually get what looks like almost like a pirate eye patch. It's clear, and it provides a really good protection, or wearing your glasses or sunglasses too. But none of that will help you close the eye. So in some cases where patients have delayed healing, and it may take several weeks, you can actually get an external eyelid weight. And those are things that you go to an eye doctor or ENT's office, and they'll test you with different weights, and you can order it online. It costs about $100, and it's usually covered by insurance. Now, I've kind of jumped around a little bit, but let's take a step back and talk about some of the causes of facial nerve damage or paralysis. So there are different kinds of facial nerve damage. They can be traumatic from an injury if you had a fall and you hit your head. They could be surgical if you had a tumor removed and the facial nerve was injured or the facial nerve was involved with a tumor. But the most common are typically what we call infectious or viral induced or idiopathic, meaning we don't know the exact cause, but we think it's related to something. Some of the infectious causes could be if you have a really bad otitis media or ear infection. As I mentioned, the facial nerve travels from the brain behind the ear in some bone called the mastoid bone. That region is actually very susceptible to getting pus formation or from an ear infection. And so in children, they can develop acute facial paralysis related to bad ear infections, and it can happen in adults too. If you have a tumor in the ear, that can also cause it, although that is exceptionally rare. Other causes of viral facial paralysis could be from something called Lyme's disease, which is usually from a tick bite. Sorry, that's bacterial, from a tick bite. And if you're in the Northeast of America, or in areas where Lyme disease is prevalent, you can actually commonly get bilateral paralysis from that. And that can be treated with antibiotics. Now, the most common cause of facial paralysis is related to something called Bell's palsy, which I can go into more in just a moment. But really what that is an idiopathic or immunologic response to a previous history of the herpes virus. Oftentimes, patients will come in and we'll talk about Bell's palsy, and they'll have read that it's related to herpes simplex virus 1, or the herpes causing mouth sores in the mouth and on the lips. And they'll say, well, I didn't have a herpes outbreak. I haven't had one for years. It really has nothing to do with what is going on in your mouth or in your body at the time of the paralysis. The fact that most of our population at some point has been exposed to the herpes simplex virus means that the virus is in our body and it never really goes away. We think the virus actually harbors itself in the nerves and the soft tissue of our body. And then during times of stress, fatigue, immunosuppression, it can be reactivated. And that reactivation causes inflammation of the nerve. And if the inflammation of the nerve occurs in a place where it's in the bone behind the ear, where it can't expand easily, then you can have a crush injury from the bone actually squeezing down on the inflamed nerve. And that is the most common cause, we believe, of facial paralysis. And when patients develop that, they'll actually complain of other questions related to the pain and related to the nerve and behind the ear. Sometimes they'll think they have pain in the ear or a bad ear infection. Sometimes they'll actually think they have a dental infection because one of the branches coming down to the jaw or facial nerve can give pain sensation in the ear into the jaw referred. And so I've actually had patients come to me who actually had a tooth pulled a couple of days before the paralysis set in, and they think the dental procedure caused the paralysis, when in actuality, they were having inflammation of the nerve that was causing the dental pain, and that pain is just a precursor to the development of the paralysis. Now, I've gone through Bell's palsy, and I'll talk to you about Ramsay-Hunt syndrome, which is similar but different. So I'd just like to let people understand. Bell's palsy is a reactivation to the herpes virus, and it really just causes the paralysis of the nerve. It can also cause some sensitivity to sound and some pain behind the ear, but that's usually it. Patients will be able to be seen by an emergency room doctor, an urgent care doctor, or even their primary doctor, get diagnosed, be given some treatment, which we'll go in through in just a moment, and then go home the same day. However, if you have a Ramsay-Hunt syndrome, you're much sicker. This is a reactivation to the varicella-zoster virus, otherwise known as the chickenpox virus. This is essentially developing a shingles, but of the face. And for anyone who's had shingles on their body, they know that it's a very, very severe, very painful disorder. When someone has Ramsay-Hunt syndrome or reactivation of the varicella-zoster virus in the facial nerve, they can have intense pain in the face. They can have a rash on the face, or a rash on the ear, or a rash on the eye. And it usually is in a distribution of one of the trigeminal nerve or the fifth nerve locations. But in association with that rash, they'll also have a facial paralysis involving one side of the face, just like Bell's palsy. And then they can also have an associated hearing loss. And even worse, they can have severe vertigo or room spinning sensation. And those patients are usually much, much sicker. They will go to the ER usually or urgent care, but they'll typically be admitted to the hospital and they may require some IV medication to help calm them down because it can be very debilitating. Now, the diagnosis, how is facial nerve damage or how is facial nerve injury diagnosed? Well, it's usually done clinically in patients who develop the symptoms that I've described of Bell's palsy or Ramsay-Hunt syndrome. If they went to an urgent care or to an ER, they would first want to rule you out for a stroke or a cerebrovascular accident, and they would do specific neurologic exam. In some cases, they may order imaging like a CT or an MRI, but oftentimes the symptoms are so consistent with a Bell's palsy or Ramsay-Hunt that they won't do any of those, and they'll know from their clinical examination that you're not having a stroke, and that it is more of the Ramsay-Hunt or Bell's palsy. But I do urge patients who have these symptoms to go to the emergency room because we do need to make sure that you're seen by a medical professional and make sure it's not a stroke and that they can then give you the proper treatment. And so treatment options. So any patient who has a paralysis that's acute onset without trauma that is diagnosed with a Bell's palsy or a Ramsay-Hunt should be placed on high-dose steroids and antivirals unless they have a contraindication. There are certain medical conditions like severe diabetes, pregnancy, other conditions in which you may not be allowed to be on the steroids because the high dose can cause symptoms that can be incompatible with your current medical condition. But if you're otherwise healthy, taking a high-dose steroid taper for 10 to 14 days with antivirals is the gold standard treatment for patients with a Bell's palsy or Ramsay-Hunt. Now, if you've had trauma and you find that the nerve has been injured, that's a different scenario. They may still place you on steroids to help reduce inflammation in your body and around the nerve, but typically if it's related to trauma and they rule that the nerve is cut or that they need to explore it, if it's due to a temporal bone fracture, that will require an urgent surgical procedure. And in those cases, usually it's not just someone like myself who's a reconstructive surgeon, but it could involve a neurosurgeon or a neuro-otologist who's an ENT surgeon that has done specialty training in ear surgery. And the three of us would work together to see where the nerve was injured and how we could put it back together. And in some cases, the nerve may not be injured, or may not be cut, but it may be crushed if the bone is involved. And in that case, the bone just has to be decompressed, or the nerve has to be decompressed. Now, those are very different cases. And in those cases, typically after a few weeks, once the patient's nerve has been decompressed, function will start to recur. In patients with Bell's palsy or Ramsay-Hunt, it usually recurs within 2 to 4 weeks. However, in cases of more severe nerve damage, it can take several months. And I'll go into that in just a moment. And I've already kind of touched upon what medications can help with facial paralysis. Just to reiterate, if it's believed to be due to a Ramsay-Hunt or due to a Bell's palsy, the gold standard is steroids and antivirals. And in some cases, if patients have not had any recovery within 4 to 6 weeks, we will do a second round. There's no data that I've seen to support doing that, but in my experience, that's what I've done, and that's what I've found has helped patients improve. Now, do I know if the steroids made them better or were they going to get better on their own? I don't. But if it was in my hands and a patient had already had one round and had absolutely no recovery, and there's no contraindication, meaning they're not going to get sick, I explain to them the risks and the benefits, and we'll usually initiate a second round of steroids. Now, how long does it take for facial nerve damage to heal? Well, that's a great question. As many patients who may be on the panel today will attest to, healing is not always possible. And in some cases, patients where family, friends, or even medical professionals think a person's facial nerve is healed, they can still have significant nerve damage. It's just not as visible to the lay person as it is felt by the patient. But when we talk about healing, let's talk about it in a couple different ways. In terms of the nerve just recovering and the nerve regaining some function and movement of the face. In most Bell's palsy cases and in Ramsay-Hunt, usually less than 4 weeks for the patient to have almost complete recovery. And when I say that, I mean they can close their eye without difficulty. They're no longer needing an eye patch to protect it. They may still need eye drops because it can stay dry for some time, but they usually don't need and their face is able to smile and eat and do things that it wasn't able to do originally. In some cases, about 10%, it can take more than a month. And in those cases, it's really just a tincture of time. There's no one who can really say when you see a patient, oh, you're going to be better in 6 weeks, you're going to be better in 8 weeks, you're going to be better in 12 weeks. It really does take different time for different patients. In my experience, and this isn't my experience alone, patients who are younger tend to recover faster. And I think that's just a facet of your body's ability to heal when you're younger. As those of us, as we get older, we realize that certain things just take a longer time to heal. And so for patients who are younger, who have the same type of paralysis as somebody who's older, it usually is the younger person that will recover faster, but not always. Now, we often get asked, are there any exercises that can help with the recovery? Now, when we think of facial exercises or facial therapy, many patients will say to me, oh, I'm looking in the mirror and I'm just forcing myself to raise my eyebrow or blink really, really hard or trying to do something with their face that it just can't do. And, I often counsel patients that I don't think this is really going to help. I really don't think that doing the, trying to muscle your way through it is really going to help. If you think about it, when you have an injury to another part of your body, whether it's an elbow or a wrist, a shoulder, an ankle, a lot of times your doctor will tell you to stay off it. They'll tell you to let it heal on its own. And I usually try to help patients understand that. One, because I don't think that the act of trying to muscle your way through it is going to do anything if the nerve has not activated the muscle. And two, because it really just gets more and more frustrating as every day goes by and you're trying to do something. I typically don't recommend any facial exercises, massage, or therapy until after we have movement regained. And at that point, yes, then it's okay. Now, are there things that patients can try that I don't think are going to harm them, like acupuncture or dry needling? I think those are great options. And if patients have someone in their vicinity that can offer that for them, it's great. But I don't actually send patients to anyone to do that. There should be noted that there's a lot of controversy about electrical stimulation. I am a believer that electrical stimulation does not help regain facial function faster. When we think about electrical stimulation, we think about the TIMS monitors and things that get put on the wrist or the arms or the thighs, larger muscles that are recovering from an injury, not typically from a nerve damage injury, but more related to injury of function from an accident. In that case, yes, it may be beneficial. But what the data has suggested for facial paralysis patients is when they do the electrical stimulation, it can actually make the recovery more difficult and it can actually lead to more complications down the road. Now, one question that we get often is, will my face ever go back to its normal appearance? Now, by definition, after having a nerve damage, there is no normal on that affected side anymore. There are patients who can get very close to normal, who recover within the first 2 to 4 weeks. But usually when it takes more than 4 weeks or 6 weeks to recover, and by that meaning no movement until 4 or 6 weeks, it's very hard to get your face back to the complete symmetry with which you had before. Now, it's also important to note that no one's face has complete symmetry. If it did, it would be actually very abnormal. And we don't really know, we haven't paid attention to what your faces looked like before the paralysis because for obvious reasons, we didn't know or could predict that you would develop the paralysis. And so it's hard to say, is some of that asymmetry just normal or is some of that asymmetry real? Again, what we focus on is not so much the symmetry of movement, but usually the asymmetry associated with the abnormal movement. And we'll go into that in just a moment in using a word called synkinesis. Now, complications or long-term effects associated with facial nerve damage is related to something called synkinesis. Synkinesis is the abnormal or aberrant regeneration of the facial nerve or reactivation of the facial nerve of different muscles that were not previously associated with those functions. And so what patients will complain of is that their facial nerve has regained function, but it's not functioning the same way their facial nerve does on the other side. For instance, when they raise their eyebrows, they may also have a pull in the corner of their mouth. When they close their eyes, they may have a pull or they may have a tug in their neck. When they smile and lift the corner, it may actually try to shut the eye inappropriately. And so what I liken this to is if the power went off in your neighborhood, and I often use this metaphor in front of my patients. If the power went off in your electrical power plant in your neighborhood and your whole neighborhood's power was out and your home was out and your neighbor's home was out and the other neighbor's home was out, the power plant, just like your brain, would want to do everything it could to make sure the energy, the nerve traveling from your brain to your face is much like the electrical wires traveling from the power plant to your home. It just travels energy to the end organ, which is the muscles. And as your brain wants to get the muscles of the face moving, it doesn't really care if when it's moving the mouth that the eye also moves. Just like if the electrical company decided, well, it didn't care if when you turned your lights on that your neighbor's lights went on, or when your neighbor opened their garage that your TV turned on. All they care about is that your food doesn't spoil, that you can get in and out of the home, and that you can function. And really, that's what your brain cares about with your face. Unfortunately, we as individuals want to have the movement that we had before the injury. And so in that case, these patients who develop synkinesis, we have other options for them. And that's where I believe the facial therapies and other medications and potentially treatments can come in. Now, in terms of the paralysis being permanent, so I will say the caveat, if you have Bell's palsy or Ramsay-Hunt, by definition, you should not have a permanent paralysis. If you've been diagnosed or your family member has been diagnosed with Bell's palsy or facial paralysis at any point, and it's more than 6 months and their face is still completely paralyzed without any movement, and they've been evaluated by a doctor who confirms that, by definition, it's something else until proven otherwise, or cancer until proven otherwise. Patients can have skin cancers that metastasize or other tumors that need to be evaluated for. And so for patients who have complete paralysis for greater than 6 months that doesn't have a known cause like a surgery or a trauma, they really need to be evaluated by a medical professional and have some imaging done to make sure there's nothing else going on. Now, in somebody who has facial paralysis from Bell's palsy or Ramsay-Hunt, and it's true and that's what it is, like I said, they'll usually get better in 4 to 6 weeks. And if they don't, it can usually resolve within 4 to 6 months. Now, the paralysis may not be permanent, but the synkinesis is. And as I mentioned, going back to your normal appearance is usually not possible. The synkinesis is what usually causes that, because the nerve is functioning improperly and the muscles are then reacting improperly. And so that's where we would need to do additional treatments, such as Botox or botulinum toxin. There's many different brands. Botox is one, Xeomin is another, Dysport is another, and that is usually up to you and your doctor and your insurance provider as to which one is most appropriate. But in my experience, they all work equally well, and it's really just a preference. And that's something that can be done usually every 90 days by insurance companies, or if you're paying for it by cash, usually it's required every 8 to 10 weeks. And what that medication does is it causes relaxation of the muscles around the eye and in the neck and around the mouth, so that when you're making these movements, the unwanted movements occur less or don't occur. These medications are very helpful for reducing tension and reducing stiffness in the face, sometimes pain and discomfort. They don't usually make a dramatic improvement in raising the corner of your mouth for a smile, maybe a millimeter or two, but in some cases, that's all they need to help them feel better and help them go out into the world and present their face. Now, talking about support groups. So we often will notify patients that there are some great support groups online and resources for patients with facial nerve damage or paralysis. There are support groups for patients who have Bell's palsy. There are support groups for patients who have and who are just healing from the Bell's palsy. There are some great support groups from patients who have Ramsay-Hunt syndrome or synkinesis related to that. And then there are also some excellent support groups for patients who had tumors or brain tumors that led to the facial nerve damage or surgery related to that. And I'll give you those resources once we're done. But usually you do have to take everything with a grain of salt. There is some misinformation there. But at the same time, they do provide valuable support systems for patients. And my patients in our group have found them very helpful to talk to other people about what they're going through, what they're experiencing, and to know that they're not alone in this. We have a few more questions left, and then I'll take your questions as well. So what can be done to manage pain or discomfort associated with facial nerve damage? Well, I just mentioned that botulinum toxin can be used to manage the stiffness or the spasms. In some cases, it can help to reduce the tightness or the pain, but typically for patients who have severe pain associated with the spasms, we will recommend facial massage or facial physical therapy as an option. In some cases, patients will require neurologic pain medication. This is usually not associated with a facial nerve issue, but sometimes when patients develop a severe Bell's palsy or Ramsay-Hunt, the trigeminal nerve, or the nerve that controls the fifth cranial nerve, can cause the pain syndrome. And that usually is associated with sensation in the forehead, the cheek, and in the mouth, and sometimes in the jaw as well. And patients who develop that will often require a referral to a neurologist. So if you're seeing your doctor and you're experiencing pain and they're not sure how to treat it, I would not fault you for asking them if they can refer you to a neurologist, because oftentimes neurologists have a much larger toolbox than your primary doctor or your ENT will have to help combat the pain issues associated with this. Now, acupuncture is also a great option. Dry needling has been found to help, which is a process in which they place needles into the actual muscles to try to relax them. But what I have found that in those cases is it doesn't last quite as long as the botulinum toxin in terms of relaxing them. Now, can facial nerve damage be prevented? Well, unfortunately, we do not know at this time who is going to have a Bell's palsy or a Ramsay-Hunt syndrome. And so it's impossible to prevent it. And the reason I bring up this question is because a lot of times patients will say or ask me if they could have done anything to stop this from happening. And really the answer is no. It is bad luck that someone experiences Bell's palsy or Ramsay-Hunt or another form of facial paralysis. It really has nothing to do with anything anyone caused. There's really no food or exercise or anything that you do that would cause you to have this. And my goal with this question is to really reassure patients, to let them know that, whether it was some type of immunosuppression or stress or pregnancy-induced Bell's palsy or Ramsay-Hunt syndrome or facial paralysis, that it really has nothing to do with who you are as a person or anything that you've done to cause it. Now, stress and emotional factors are associated with immunosuppression and associated with having a weaker immune system. But again, they don't contribute to facial nerve issues. Now, are there alternative or complementary therapies that can aid in facial nerve recovery? The only ones that I'm aware of are the acupuncture and potentially dry needling as mechanisms to help relax the muscles or help to help to work with the muscles and the nerves of the face. To this time, I am not familiar with any other therapies. Now, there are people doing research looking at some forms of electrical stimulation, some forms of needle activation of the muscles, but none of that has been proven to be efficacious yet at this time. And if it does become, we will share that information with you later and let you know about it. There are no alternative medications other than the steroids or antivirals at this time. And none of the other supplements I'm aware of have really been studied to help patients with facial nerve injury. Now, the last question is, are there any surgeries available for repairing facial nerve damage? Well, the answer is obviously yes. Otherwise, I wouldn't have a job. But, there are surgeries available to patients most commonly for those who have either very severe synkinesis, meaning they have abnormal nerve spasms and facial movements which they are unable to treat with facial therapy or with botulinum toxin, or for patients who have complete chronic paralysis that typically is not from a Bell's palsy or Ramsay-Hunt, that may be from a nerve injury or trauma, from a tumor resection, or from a trauma to their temporal bone if they fell and the nerve was cut. And in those cases, yes, surgery would be beneficial, in rare congenital conditions as well. But the vast majority of patients who present with Bell's palsy-related facial paralysis or synkinesis after a nerve injury that's recovered are not going to be recommended to have surgery unless they have severe synkinesis or severe chronic facial paralysis. As I mentioned, there are some resources here that I wanted to share. This is not an exhaustive list. It's just 3 places. Our website, where we have some information on the conditions and treatments, and we've done some other webinars, including some of my colleagues from around the country who've provided some excellent information. I would, especially if you're in the areas where they practice and you would like to see them, you can always reach out to us and we can give you their contact info as well if you can't find them online. Facial Palsy UK is a great resource. I recommend all my patients check out that website. It has information for everyone who is suffering from facial paralysis, and whether it was from Bell's palsy or from another cause. And the Acoustic Neuroma Association. Now, this is an association for patients with acoustic neuroma tumors, and you have to pay to be a member, but it's a great resource. It also has with it several online support groups for those patients suffering from those tumors and for their family members and caregivers. As I mentioned previously, I'm affiliated with Pacific Neuroscience Institute, based in Santa Monica, California. And so these are some of my other colleagues who we work with. And so I'd just like to acknowledge them and thank them for their support for all the work we do. So I'll stop sharing now. And what we'll do is we'll go through some questions that you have related to that I may or may not have answered already. So I'm going to open it up to the chat, and we have questions here already. And we have about another 10 minutes, so I'll try to go through these. And so there's one question here. The first question says, when I speak, my lower face on the right side goes downward, but my doctor said it's due to overactivity of the DLI muscles and advised Botox, but I wanted a permanent solution. So if I may have to I may have to add some to this question, but it sounds like the contralateral face. So when patients have paralysis of one side, usually the DLI on the affected side, when they smile, doesn't go down. The depressor labii inferioris muscle is important for pulling down the lip when you smile and pulling down the lip. So it pulls down the lip in the central portion, and there's one on each side. If you have a facial paralysis and that nerve is injured and it doesn't work, oftentimes we will actually use botulinum toxin to inject the contralateral side. This is a very important point. Patients who have synkinesis or facial paralysis don't just get treated on the side that has paralysis. I often have to explain to patients that we're going to treat both sides. And the reason being is we want to create symmetry. And in some areas, when we relax the muscles, we're actually going to get rid of the wrinkles and get rid of some of the movement. We want to make sure it doesn't cause confusion for observers or make things difficult for the patient, so that they can also have treatment on both sides and be more symmetric. In this case, we don't have a surgery to reconstruct the DLI that's not functioning. So we'll Botox the other side to help weaken that, so that when they smile, instead of pulling down both aspects, it'll be a little bit less teeth show, but symmetric. Now, a permanent solution for that at this time is not really possible. We could go in, yes, and cut that muscle on your contralateral side, but I would not recommend it, as it could potentially have some other side effects. And it's not as easy as it sounds. Now, there are doctors out there who are doing static procedures, meaning they don't create movement, but using some fascia or some other material, we might be able to permanently pull down the affected lip. Again, it's really up to patients and their provider to decide if that's a good option for them. But that might be a solution to help pull down the DLI on the affected side. The session is being recorded, just so everyone's aware, and it will go up on our webinar once it's been edited, just so everyone's aware. A question here. Does facial nerve damage cause nerve pain? I had a tumor that was wrapped around the 7th and 8th nerve, and I now have occipital and trigeminal neuralgia. Yes, facial nerve damage can be associated with pain in the face. Now, trigeminal neuralgia and occipital neuralgia are two different conditions, two separate conditions related to pain associated with the nerves in the distribution of the occipital and the trigeminal or fifth nerve. Trigeminal neuralgia, which I'm more familiar with, can cause excruciating pain in the trigeminal distribution, which, as I mentioned earlier, is the forehead, the cheek, the lower face sensation. It can also cause pain inside the jaw and the mandible. And these patients will have severe pain. Without knowing exactly how the tumor was located and how the treatment occurred, it's hard for me to speculate, but I can say that oftentimes tumors or inflammation of the 7th and 8th nerve can be associated with the 5th nerve. Not so sure about the occipital nerve, but these nerves are very closely associated, and inflammation in one area is often associated with inflammation in another area. Now, it's important to mention, I did not say this, but the facial nerve actually has other functions. In addition to movement, it can cause sensory issues with the tongue, and so the anterior taste buds are controlled by the facial nerve. So when patients have a facial paralysis, they first actually sometimes will notice that their tongue or their taste is metallic on one side, and that may or may not go away after the recovery. Additionally, patients can have sensitivity to sound, and they can have dry eye if the facial nerve is injured. And sometimes patients will develop what are called crocodile tears, so that when they eat, their eye will, or when they chew, their eye will tear. And that's because the glands in the eye, lacrimal gland, which is now producing tears, are misfiring, and they're associated now with your chewing function and moving food in your mouth. And so there's other sensory and special fibers associated with the facial nerve, not just movement. A patient asks, about 3 years post Bell's palsy diagnosis, has some synkinesis, has bouts of pain that is beginning to affect quality of life. Might this be trigeminal neuralgia? Yes. So if someone has a severe Bell's palsy or Ramsay-Hunt, it's not uncommon for their facial nerve and their trigeminal nerve to be involved. And if that's the case, if they had an experience of sensory issues like numbness on the face or cheek, it's not uncommon to maybe have nerve damage related to the trigeminal nerve as well. The best thing to do would be to see an expert in trigeminal neuralgia, and they may do an evaluation with imaging as well to see if that is what you have. And if it is the case, then hopefully some treatment would be available to you. And a neurologist may also be a good person to see for that. Question here is specific to a patient who's 57 and born with Bell's palsy. Since I was born with it, virus does not seem to be the cause. Would surgery be an option? Well, if you've had complete paralysis for 57 years, most likely this is a congenital condition. There are several known congenital conditions causing facial paralysis, and some could be due to the delivery itself, if there was a forceps delivery and the facial nerve was injured. That being said, surgery would likely be an option to help you. It just depends on how severe the paralysis is, and also your other anatomy to see if there's any other nerves involved. Sometimes patients who have a facial paralysis congenitally, meaning they're born with it, may have other nerves that were also improperly developed. And so we would need to evaluate you and to see if for instance, if your masseter was functioning, your muscle, your chewing muscle, that could be an option for a donor nerve. We'd also want to maybe do some testing to see which blood vessels you have available if we had to do some other surgical procedures on you. But surgery could be an option for you if you met the proper criteria, yes. Okay, question here. What are your thoughts on selective neurectomy for facial paralysis from an acoustic neuroma? So selective neurectomy is a surgery that is recommended for people with severe synkinesis, meaning they actually have facial movement. And so this synkinesis, as I mentioned, most commonly occurs secondary to prolonged recovery after Bell's palsy or Ramsay-Hunt, but it can also happen after acoustic neuroma removal, which this patient says that they have. So if the patient has a tumor and they developed paralysis, but temporary paralysis after the treatment of that tumor, they may also be susceptible to developing synkinesis afterwards. In those cases, it really would depend on how severe the synkinesis is. If they're not getting better with physical therapy or Bell's palsy alone, or botulinum toxin alone, and if they met the proper criteria. But that would have to be evaluated by a surgeon with experience managing these patients, which is something that we do all the time. And so in that case, you have to evaluate you first and see. Oftentimes, I will recommend patients try botulinum toxin for the synkinesis first, as surgery is a very aggressive option and there's really no turning back. And often cases, patients will still need some chemodenervation or botulinum toxin after the surgery as well. And so we have to make sure patients can tolerate it. Does UpNeek work on affected eye to make open more, and is it safe? UpNeek, for those who don't know, is a medication that is used to help open the eye and make the eye bigger. And it's usually helps to prevent ptosis. And so, yes, it can work. It is safe, but it should be prescribed or given to you by a treating physician. And so it's something that can work. But again, you have to make sure you have the right criteria for it, that you meet the right criteria for it, and that it's prescribed by someone who's a specialist in the eye, not just by, especially if you have a history of facial paralysis. Why do you recommend taking antivirals with steroids? Also, would that be recommended treatment who has facial paralysis from a brain tumor removal? So why do we recommend antivirals and steroids for patients? Well, that's typically recommended for patients who have what we believe to be a virally induced Bell's palsy or a reactive facial paralysis from a virus, such as herpes simplex virus or Bell's palsy, or Ramsay-Hunt syndrome for varicella zoster. In those cases, the data suggests that with taking antivirals, you can help prevent the post-herpetic neuralgia or the pain associated with long-term side effects. So that's why we recommend the antivirals. For patients who have a facial paralysis secondary to a brain tumor removal or like an acoustic neuroma, the antivirals are not recommended and patients get just steroids. That's an excellent question. Okay, this will be our last question. It's a patient with synkinesis from Ramsay-Hunt syndrome. They underwent a DAO excision last May. They get botulinum toxin every 3 months. The question is regarding continuously doing physical therapy and still struggling to have a symmetric smile. So this is a little bit of a complex question, but let's go through it. So the patient had Ramsay-Hunt syndrome and developed severe synkinesis. As we mentioned, Ramsay-Hunt syndrome is from varicella zoster, and if it can cause more severe side effects. Those more severe side effects are not just in the dizziness and vertigo and hearing loss, but it can also cause more severe paralysis and more severe synkinesis. They underwent a DAO excision. A DAO excision is the depressor anguli oris muscle, which is important for pulling down the corner of the mouth. The depressor labii pulls down the central lip, but the depressor anguli pulls down the corner of the mouth. And when patients have synkinesis, when they try to smile, sometimes the DAO, rather than relaxing, will actually pull down too. So their mouth corner is kind of stuck and doesn't move. So rather than going up, it just kind of stays there because that muscle is always active. And we'll Botox that muscle or botulinum toxin that muscle. And in some cases, we'll actually cut it out. So they actually had the muscle removed. And they're still getting Botox in other parts of the face. So just to give you a background. Now, the patient is still doing physical therapy and they're struggling to get a symmetric smile and they can't get their upper and bottom lip to open. So their question was, are there any recommended options for treatment? Well, this is not uncommon. The DAO procedure is great, but in my hands, I'd say it works about 50% of the time. We will often inject some numbing medicine like lidocaine beforehand to see if patients will get an elevation of the corner of their mouth. And I think they can get a subtle but as I mentioned, not a complete elevation. And so we have to be honest with our patients and let them know that it probably works half the time that we do it, and it really only helps to give relaxation, reduce the tightness, but giving corner elevation of the mouth may only happen in half of the patients that undergo it. So we have to be very, very careful on who we recommend it to. Now, if we do recommend it and you undergo it, are there any downsides or side effects? Not usually. So a lot of doctors will recommend it to all their patients, but we have to be honest with them that it really only works in specific cases. And so if you've gone through that surgery and you're still unable to have a symmetric smile, we'd have to evaluate you in person to really see what other options we have. In some cases, I will do DAO excision first, see how patients do and tolerate it. And then I'll go back and do a selective neurolysis, which is the surgery I mentioned before, where we would actually go in and remove certain nerve branches that are acting improperly. But again, it's a very complicated situation and every patient's different. So we have to evaluate you first before we made an ultimate decision. And just so patients know, we are able to do virtual visits. You could reach out to us at Pacific Neuroscience, and myself or my colleagues would be happy to evaluate you. And depending on where you're located, we could potentially come up with a plan for you or refer you to one of my colleagues all over the country. My goal through these webinars is not just to educate you, but also to help you find who the best person to treat you is, and it doesn't have to be me. And so I really, really appreciate your time. I really appreciate you sharing your afternoon with us or your lunch hour with us. And if you wouldn't mind, please sharing this video and sharing the information that you received here today with anybody else who may be suffering with Bell's palsy or Ramsay-Hunt or facial paralysis. Our goal is to educate you and to help you get to where you need to go, and we'll do everything we can to help. So thank you so much for your time. Thank you to our marketing team for helping us support this event, and to all of our friends and patients who shared this information, and we hope you have a great day. If you have any other questions, feel free to reach out directly. We'll be happy to help however we can. Take care.